Imagine the shock of seeing your health insurance premium skyrocket from a manageable $60 a month to a staggering $1,030. And that's exactly the reality thousands of Alaskans are grappling with as federal subsidies teeter on the brink of expiration. But here's where it gets controversial. Is this just a policy hiccup, or does it reveal deeper flaws in how we support affordable healthcare in our nation? Let's dive into the details. Many residents in Alaska depend on the federal marketplace, an online platform established under the Affordable Care Act, often called Obamacare, to secure health insurance. This system offers plans from private companies, and for years, federal tax credits have acted like a discount, making these plans accessible for millions of Americans. Without these subsidies, premiums can become prohibitively expensive. Now, as Congress debates whether to renew these credits before the year ends, Alaskans in places like Juneau are feeling the immediate pinch. And this is the part most people miss. The uncertainty isn't just about money, it's about potentially losing access to essential medical care that could save lives. Take David Elrod, for instance. He's been booking performers at the Crystal Saloon in downtown Juneau for nearly 2 decades, and none of his bar jobs have ever included health insurance. Currently, he pays around $60 monthly for a basic plan through the ACA marketplace. When he tried to renew for 2026, the quote jumped to $1,030 a month. To clarify for those new to this, a deductible is the amount you pay out of pocket before your insurance starts covering costs. In his case, it's $2,500 per year. He describes it as far from a luxurious Cadillac plan, and he's even skipping dental coverage this time to keep things somewhat affordable. David isn't alone in facing these massive hikes. These federal subsidies, which reduce what lower and middle-income people pay for premiums, are slated to end unless Congress intervenes. Interestingly, this subsidy extension was a core sticking point in the recent, unprecedented government shutdown that disrupted federal operations. For beginners wondering how this works, the subsidies are like a government-backed voucher that offsets insurance costs, ensuring plans stay within reach for qualifying families. Without them, the affordability vanishes. Alaska estimates that about 27,000 residents purchase insurance via the ACA. Nationally, according to KFF Health News, those relying on subsidies could see their monthly payments surge by an average of 114% if the credits lapse. But Alaska might fare even worse, a state already dealing with some of the highest healthcare costs in the U.S. due to its remote location and limited providers. For example, the Alaska Beacon reported that in Juneau, average premiums for state-run insurance could leap from $128 to over $1,000 a month, potentially leading some to forego coverage altogether. And here's a controversial angle. While some argue government subsidies are a lifeline for the vulnerable, others might question if they create dependency or unfairly burden taxpayers. What do you think? For David, dropping insurance isn't feasible. He has a medical condition that demands costly medication to ward off life-threatening blood clots. If I skip this, the clots could return and be fatal, he explains. Desperate, he's considering reducing his dose from 2 pills a day to 1, a risky decision driven by financial strain. This highlights a broader issue. When healthcare becomes unaffordable, people make tough choices that could endanger their health. Fortunately, resources like JAMHI Health Wellness in Juneau offer a safety net. Heidi Adams, a care navigator there, emphasizes that every person's needs differ, so they provide tailored assistance in connecting people to affordable options. JAMHI, a nonprofit, delivers primary care and behavioral health services regardless of insurance status. With Alaska's sky-high healthcare expenses, think limited specialists and high travel costs for care, many already struggle to access treatment. Heidi predicts a surge in visitors if subsidies end and Medicaid faces upcoming restrictions, as more folks turn to this nonprofit when private insurance feels out of reach. Randy Garcia, who handles intake and supports providers at JAMHI, calls it a crucial lifeline during uncertain times. When expected supports vanish, it's terrifying not knowing where to turn, but JAMHI is always here, he says. For those in similar situations, open enrollment for the federal marketplace runs until January 15th, with a December 15th deadline for coverage starting in the new year. David, for one, is delaying his application, hoping for a last-minute change from Congress. This issue underscores the fragility of healthcare access. especially in states like Alaska where costs are amplified by geography. But is it fair for hard-working individuals like David to bear the brunt, or should the government ensure these subsidies continue? And what about the debate over whether federal shutdowns over policy disputes prioritize politics over people's well-being? These are questions worth pondering. Do you believe Congress should make extending these subsidies a top priority? What alternative approaches to affordable healthcare can you envision, like more local nonprofits or statewide reforms? Share your opinions and experiences in the comments. I'd love to hear differing viewpoints and spark a meaningful conversation. Sign up for The Signal. Get top Alaska stories delivered to your inbox every week.